we'll keep letting people in as they come, but I think it's time to get started. So I'll start by introducing myself because I probably look unfamiliar to a lot of you. That is because I don't usually host these. It has been our executive director, Lena, in the past, who's also in the call, but I will be hosting today. I'm Brett Norris. I'm IPHA's new membership coordinator. I've been here for just a couple months, and I'll be here through the end of the year as an AmeriCorps Vista program member. Thank you all for coming today. It's nice to sort of meet you. Welcome to IPHA's Third Thursday Lunch and Learn web series. It's organized by IPHA Education Committee. We like to dedicate this time every month to sharing our successes and even some of the detours that it takes to get to those successes, because we realize that those things can help us grow too. So the point is to connect, learn, and strengthen the voice for public health in Iowa, which of course is part of the mission of IPHA. If you're a member of IPHA, we thank you for that. If you're not yet a member, we invite you to join us and help carry out our mission. You can do that on our website at iowapha.org. Today, we're talking to Elizabeth Faber and Nathan Boonstran of Iowa Immunizes. They're going to share about their efforts to protect and boost immunization rates across the state. Before we get started, a couple housekeeping items. Your microphone is muted, and a lot of your videos are off. Your microphone will be muted. Or just help people be able to pay attention to the presenters more and also help us with bandwidth so that they don't start cutting out and everything. But you can put your questions in the chat or Q&A features here on Zoom. This session is being recorded and it'll be posted to the IPHA YouTube channel afterward. So now that I've introduced myself, I'll turn it over to Elizabeth and Nathan to introduce themselves and Iowa Immunizes. Elizabeth, Nathan.
All right, that sounds good. Thanks for having us, Brett.
Yep.
Yeah, my name is Elizabeth Faber, and I'm a consultant working with IPHA to facilitate the Iowa Immunizes Coalition. And I recognize many of you on the call. Welcome. Thanks for joining us. I did see there was some questions wondering if we have slides. So this won't be a presentation with PowerPoints. We did not do that. We are willing to do that for your organization if you'd like to learn more about Iowa Immunizes, so just keep that in mind. But this will just be a conversation, and IPHA does always record these and upload them to their YouTube channel. So we'll make sure that you have access to that. I'll go ahead and let Nathan, the chair of Iowa Immunizes, introduce himself. Dr. Boonstran.
Hi, I'm Nathan Boonstran. I am a general pediatrician here at Blank Jones Hospital, and I've been kind of interested in the topic of vaccine advocacy and a lot in terms of just vaccine education and myth busting for quite a long time, decade or more, that's been a special interest of mine. And so I've known Elizabeth for some time through those channels, and there was kind of a point, and Elizabeth can probably tell a little bit more of the history and the origins and how we've developed as a coalition when we get into this. But there's a point when between Elizabeth and me and Lena, recognizing the need for a statewide coalition to promote good immunization information and at the same time be watchful about legislative concerns, about public health concerns, and bringing together everybody that's needed, recognizing how immunizations impact so many aspects of our lives, that there are so many organizations as well as individuals that are supportive of immunizations in Iowa. So that's how we kind of got the group together. Technically in 2019, though some of our official meetings were in 2020, whatnot. I don't know what the technical timeline there is, but in 2019 we were founded, and here we are. So we had a few suggested questions, so I'm going to take it from the top on some of these, and Elizabeth I'll pass off to her as however, and then we're happy to take questions really at any time, but I suppose mostly at the end. So one of the questions was, what's the current state of immunizations in Iowa? And that's actually a tricky question to answer, especially right now in the era of COVID here, because that is in flux, but it's also been in flux over the last 5 years. So if you go back and you start looking at recognitions, and depending on what kind of metrics and studies that you use, Iowa's actually been really high and strong in terms of overall immunization rates. If you look at our measles immunization rates for 12-month-olds or 3-year-olds or whatnot, those have historically been pretty good. But if you start looking then at the last 5 years, you start to see increased use of exemptions, like religious exemptions in the state. You start to see creeping increases in some vaccines that are being more likely to be refused. And so we're starting to see that creep over time. Exemptions in particular have gone up when it comes to school exemptions. And that's one of our major concerns, because that's going to translate into overall decreased immunization rates. The real kicker here is that in 2020, when COVID hit, in Iowa, as well as every state, childhood immunization rates took a hit as well, because in part because parents being concerned about bringing their kids in when the pandemic was early, people not knowing what was safe and not to do, what was not safe to do, rescheduling appointments, even for those really time-sensitive infant vaccines, the 2-month-olds, 4-month-olds, 6-month-olds, those ones that are super important to get on time, those were getting delayed. As providers, we were also making decisions about the less time-sensitive vaccines to delay those appointments because we didn't know how COVID was going to go down in March and April. So across the board, it's taken a hit. Distribution's taken a hit. All of these factors have been taking a hit. And so getting those immunization rates back, all of us, pediatricians and doctors and providers, we've all been working our best to make sure that families know to come in to get their immunizations done. But it's going to take work to come back from that, which is one of the reasons why things that we've been seeing legislatively have been such a concern this year more than most years. There's legislation trying to move through that some of these groups are trying to increase exemptions, trying to make it so that employers can't require even basic vaccines, even in healthcare. All of these things are going to make it extremely difficult for us to bring back immunizations to the place that they were. And they're going to make it so that if we can't do that, we really are going to start to see outbreaks in Iowa. Like vaccine rates are going to be, getting low immunization rates like we've seen with COVID. That's going to translate into outbreaks unless we do something about it. And one of the great things about Iowa is we just don't see outbreaks of these things very often. Measles is a big deal. We see 1 case, 2 cases of measles. It's a huge deal because we never see it. And we saw it in 2019. We saw 2 cases, and that fit with how nationally we were seeing more measles than we had seen in a quarter of a century in 2019. That wasn't going widespread through Iowa, but we were seeing even 2 cases in Iowa was a big deal. So I very much am worried about getting these immunization rates back up so that we don't see these diseases coming back to our state. And it surprises me that some legislators think that it's a good idea to place that invitation out. Elizabeth, what do you think?
I definitely obviously agree. I think most on this call are engaged in immunizations. So it probably isn't much of a surprise to you that our immunization rates are historically high in Iowa. We're pretty proud of that, and we take pride in that. And I know, however, there are pockets, and as Nathan said, we are worried about that changing. And so it's important that that we come together as a group. That's what we, as Nathan said, when he sort of described our origin story, there have been other coalitions in the past. Some of you were probably involved in the most recent coalition, but that disbanded quite a few years ago. But there's still a lot of interest in working together. And if nothing else, we in public health in Iowa do that very well. We all work together. Many of us work together on many different committees and many different topics. It's kind of, we're all the same faces, but we needed a formalized structure to do that. And thankfully IPHA is heading up the Iowa Immunizes and is finding the funding. So all of your membership to IPHA, your donations to IPHA help support the work of Iowa Immunizes. And we have quite a few things on our agenda, quite a few things on our wish list, but we definitely need to work together for things like what Nathan mentioned, especially right now. We're really busy with legislative stuff, unfortunately. But fortunately, we are working and we are able to share and communicate and coordinate our efforts. And I think it's, we hope that it really is making a difference, helping to educate our legislators and other policymakers on the importance of keeping our immunization rates high and not passing policy that isn't science and evidence based. Brett, I don't know if you wanted to jump in with questions to guide our conversation, or you want us to just keep going.
I mean, if you want to just keep going, that's great. But I have some pretty good questions here to prod you along.
You just push yourself right in there.
Okay, yeah, you guys have talked a lot about the state of immunization in Iowa, specifically how it has been in the past and how we've had particularly high immunization rates, but the trend might not be going in the right direction. So my next question is, where would you like it to be? What does the coalition hope to achieve? You've kind of, I suppose, touched on that with simply, we want to get back to high immunization rates. We want to improve those rates across the state. So I guess a better question might be, how can the coalition do that? What steps are being taken? And maybe what are you doing currently right now? You touched on legislation. So if you want to go into those things, how can we get there?
Elizabeth, why don't you, if you don't mind, why don't you start with that and give kind of an a roadmap of what the kind of things we've been doing, and then I can kind of fill in.
Yeah, for sure. So we've actually, as Nathan said, our origin story, we're about a year old. We're celebrating our 1-year birthday probably for 6 months. We're not quite sure where that fits. So we're still celebrating. But like many of you, then we were affected by the pandemic, of course. So we are building this house, this structure. What we had anticipated the year of 2020 is really building the structure of the coalition, because we know that is very important, and that's a part of good public health work. But because of the pandemic and because of the onslaught of anti-vax legislation, both last year and of course this year, we've really been building this house as we're living in it. So it's been messy, but we've done a lot of work. And part of that is because of the structure and the commitment of the volunteers. Many of you are on the coalition, and we do have some of the committee chairs on as well that give selflessly of their time. So we do have some standing committees besides the steering committee. We have a communication committee, and so Rachel Stram is on, and she volunteers as our communication committee chair for Iowa Immunizes. And so that is one method that we wish to make sure that good vaccine information is getting out there. We have definitely seen a rise of misinformation. You all see it. Just open up Twitter and Facebook, and it won't take you long to see something that is not correct regarding immunizations. Of course, we're really seeing that with COVID, but even before COVID vaccine, there's all sorts of myths. I think if we went around, y'all could tell me a myth that you've heard regarding immunizations. So we want to be a voice that Iowans look to trust. And so we amplify those of you at the local level that are doing good work. We're amplifying the state level. We're amplifying different organizations that are science-based. And so that is a big part. And also providing educational materials. We have internal ones that we have worked on. We've provided educational materials on vaccine safety. We've worked with partners to do a COVID vaccine handout. We've done some on vaccine hesitancy. We're working with a partner regarding vaccines and SIDS to do some education on that. So that is a big part, that communication piece and the education piece. And we have lots of ideas and plans moving forward. We also have a legislative engagement piece. We've talked a lot about legislation already, but that is a big part of the coalition, of course. So that is headed up by Deborah Thompson. Many of you know Deborah. Of course, she is also one of the advocacy co-chairs for IPHA's advocacy committee. So Deborah has done a phenomenal job of organizing our legislative work and bringing together government relations from all of our different partners and just really strategizing together. So we So all of those individuals that are at the Capitol all the time, that have relationships with legislators, can work together and sort of divvy up the work, because there's a lot of work to be done. We have held legislative engagement webinars. Last fall, we held a vaccine kind of 101 that Nathan was on. That if we do have that on YouTube as well, maybe we'll make sure to highlight that for those of you that are on the call, so you can look that up. That would be a great thing to review. We partnered with Iowa Bio for that. They're a big partner with us, represents a lot of industry. And then we had a follow-up to that regarding COVID specifically, and the vaccine, and the manufacturing of that, and how that came about. So that, in the Iowa ties to that too, with some of our researchers and experts at the University of Iowa. So legislative engagement, a big part of the coalition. Of course, lots to do, lots that we want to do. We have found it's very important to continue to educate our legislators. They are they know a lot about a lot of little things, but we definitely need to be the experts in the room and connect them to the experts in the state, so they can get the correct information. We have some very loud individuals that have the ear of many legislators, and they are very loud sharing the incorrect information. We want to make sure we're doing that correctly. And then we, of course, have a sustainability committee, because like all coalitions, we need to ensure that we can continue and both have sustainability resource-wise, as well as engagement and recruitment and retention of our partners. We have a scientific advisory committee, of course, that also reviews everything that we send out to make sure that it really is all evidence-based and science-backed, and that it's all correct information. One of the exciting things about Iowa Immunizes that sets us apart from other coalitions is that we were formed with a focus of health equity in mind. So we do have a health equity committee. In fact, we just met this morning. See that we have Gloria Verme on this Zoom. She's a member of our Health Equity Committee. Our Health Equity Committee is chaired by Brett. And so we are moving forward with identifying the voices in Iowa that are already working in health equity, that are working in this arena, and amplifying those voices and making as part of the conversation, and making sure that, of course, right now, equitable distribution of COVID-19 vaccine. We've had some media interviews regarding that, and making sure that health equity is part of the conversation when it comes to immunizations, because we know that populations have been disproportionately affected. We see that real time with COVID, but that is true with other vaccine preventable diseases as well when it comes to access. I think I'm cutting into some of your questions, Brett, but that's the structure of the coalition as a whole. So we have lots of goals, lots of things that we want to focus on, and it only happens with all of the various partners and working together with them.
Which is really one of the best things, because as I kind of alluded to before, just seeing how many organizations are pro-vaccine and how they recognize that vaccines affect things like health equity, how they affect their groups, is extremely powerful. And it's so important to recognize. One of the most important things that we're doing is getting people together, because it's important to recognize that overwhelmingly people are in favor of vaccines. They are not as vocal about it as people who may not be in favor of vaccines, because it is an ordinary everyday thing. It's like being pro seatbelt. I'm all for it. I make sure that everybody gets their seatbelts on, but I don't have to go like posting on Facebook about how great seatbelts are, because that is recognized and understood, and in some ways kind of boring, right? Vaccines are, when you really dig into how vaccines work, they're not boring, but you get immunized, you don't get diseases. That's not super headline news kind of stuff necessarily. So bringing together coalitions of people, groups of people into a coalition is extremely gratifying. And also the importance of individual voices that we have to be able to get together. And that's where, when we talk about the spread of misinformation and groups that spread misinformation, they tend to have individuals that can show up to things and influence things with misinformation. And it's so important to be able to have people that will stand up for good information, accurate science-based information. And that's one of the most important things that we're doing right now, is bringing people together, both individuals and organizations.
Yeah, I think that's an important point, Nathan. We're not just a coalition of organizational members. That's important, and that's who we highlight in our promotional materials. But we also are made up of individuals, and that is a goal where we want to be, is increasing our individual membership and engaging our families and those with stories to tell, because many do have stories that they need to tell, and our policymakers and others need to hear those. Just way more important than the loud stories that are not backed in science.
Thank you for all of that. The entire structure. 'Cause I'm learning right along with most of the people in this call about, well, a lot of people in this call probably know more than me about immunization in general. I've been here a short time, like I said, so and you've touched on this question, my next question: what challenges do you see facing the state of immunization? So you've talked a little bit about the anti-vax, like the rise of that kind of ideal in the individuals and how they mobilize, and the misinformation. So are there any other challenges? Is kind of what I'm wondering. Are there other major challenges, or is that really one of the big ones, or the big challenge? And how can you overcome that? How do you overcome that? What's the, how do we take down that beast?
You know, one of the best things is that when we talk about, one of the things that I talk about a lot and have been for a long time is specifically how to address misinformation in groups that spread misinformation. One of the best ways to do that is to not debunk. It's actually best, and your time is better spent providing accurate information and spreading good information than trying to debunk somebody's bad information. There are specific instances where that debunking is good. If you have a good personal relationship with somebody, you know them and they trust you, and then they say something or present something or post something that's not accurate, you have that kind of relationship where you can break that down for them. There's other situations where if it's something that's widespread, it's really good to get debunking out there. But the best thing that most people can do is lead by example. Show people that you're immunizing and that you believe in it and you think it's important, and that you believe in the science and the evidence and the experts, with simple terms. You don't have to be an expert in every myth that's out there about vaccines and every ingredient to be able to say that you believe the overwhelming consensus of experts. And also, we see that social networks matter. So what we want are people to be a part of, social networks influence people in their vaccine decisions. People who are surrounded by people who don't immunize or say misinformation about immunizations, they're more likely to not immunize. So being a part of people's social networks and being that positive influence for science-based information with immunizations, that matters. And those decisions are made even before babies are born. Surveys show that a lot of parents, if not most parents, have made up their minds kind of before they've had kids, how they feel about vaccines. So it's not just talking to somebody who's already had a child, it's about presenting that information into the world in general. It is very important. So that's one way. And getting together groups and being able to disseminate that information is a way that we can do that.
Thank you, Nathan. So that kind of gets to where my next question was, so we clearly, we all want the same thing, really, and that's a good point to bring up, that it's better to present good information rather than debunk bad information in a lot of cases. And so the point that you want to make with your information is, basically, you just want to prove vaccines are good for public health, and they keep our communities healthy, which is ultimately what we all want, whichever information you're using to try and reach that goal. You want to present your information and make people realize that that is the way to do it. So how have advancements in immunization impacted public health overall? What difference have we seen in the last however many years? What difference has it made? That's my next question.
Yeah, huge differences. Some of the things, when we talk about some of the immunizations that we give, so I graduated medical school in 2003. I graduated residency in 2006. I am fortunate enough, as old as I am, to be young enough to not have to have lived through the horrors of being on a pediatric floor during the time of Hib epiglottitis, during seeing kids with pneumococcal meningitis and pneumonia. That was greatly reduced when that vaccine came out right around 2006, if I remember correctly. So a lot of these things, even in my practice as an attending, I've been able to practice in a situation in which I don't have to worry about a lot of different diseases. And so that every one of these things that we immunize against has benefits that a lot of times people don't recognize. So when people think about chickenpox, they think about, oh, I was sick and I was out for a week and I watched Transformers for a week when I was a kid, at least if you're an 80s kid like me. And so what's the big deal? Everybody goes through it. And then when you start to dig into that, you realize, you know what? There's a really good reason why we immunize against chickenpox. Not only did it kill 100 people a year prior to the vaccine, hospitalize 10,000, but also if you get wild chickenpox, that's how you end up getting shingles when you're an adult. A third or so of adults, because they got wild chickenpox when they were kids, they have an outbreak of shingles in their adulthood. And by immunizing against shingles, we can reduce that incidence. So every one of these diseases that we immunize against for very good reasons. That's why it's on the schedule. And it impacts a ton of things too. So we're not just thinking about how it makes people ill, but we think about how not having to worry about these diseases impacts people and impacts disproportionately different groups of people, because if you have to stay home and take care of a child, that impacts you financially. This has wide-ranging impacts that being able to prevent some of these serious diseases has had on society. Elizabeth, you probably have some more general public health ideas as far as the impact of immunizations.
Yeah, I think many of us in public health recognize immunizations as one of our top achievements that's widely touted. We know that as public health, we are, as with a lot of things in public health, we are a victim of our own success. So like you said, Nathan, immunizations they're just that's just what you do. You get up and brush your teeth, and then you take your kid to their well child visits. Those are just things that we do. And it has greatly impacted a lot of things in public health. We don't have numbers and things like that for you to share. Most of you on the call are already immunization advocates, I'm sure, self-selecting to listen to this Lunch and Learn. And so many of you probably have lots of things you could share from your agencies and organizations as well. But it definitely is a huge part of public health, as Nathan mentioned, in lots of different arenas. Having high immunization rates in a healthy community is important for a thriving community as well.
One of the things that sometimes isn't realized is when we've had these discussions with legislators and whatnot about SIDS, but as we've added more vaccines to the schedule, SIDS rates have actually declined over the decades. And some of that is not necessarily causative from vaccines. Of course, the Back to Sleep campaign did a lot of that work. But there actually is evidence that immunized kids have reduced rates of SIDS compared to unimmunized kids. And some of that might be because of either protection against the disease, because maybe historically some SIDS cases were kind of or at least contributed to by subclinical infections that we immunize against now. But also it seems that there's cross protection. Some studies have looked at cross protection against bacteria that are implicated in SIDS. And so again, even trying to control confounding factors, we find that immunized kids have lower rates of SIDS. We also see that infant mortality over time has gone down in the United States as more vaccines have been added to the schedule. So those are two ways in which, you think about vaccines preventing these individual diseases, but they've had overall positive effects on public health in those ways.
Thank you. So moving on from there was a comment in the chat um, about about specifically the COVID-19 vaccination rollout and how um, certain individuals have been left behind in that. And obviously there's major shortages which contribute to all of that as well. But that brings up a question for me, and you can address that if you can see the chat. You can address that more directly if you would like to, but then that also um, brings up the question for me, um, how does health equity play into immunization, um, whether it be COVID or in general?
Yeah, for sure. So as we're seeing live, access to vaccine matters. It is frustrating that we don't have access, that we don't all have access to the COVID-19 vaccine. We're living this in real time. We've heard stories of this from other infectious diseases, but this haven't been able to. Unfortunately, like Brett said, a lot of in relation with COVID is in relation to lack of vaccine. But that isn't the case with other vaccines, and health equity matters as far as immunizations. Social determinants of health, as we know, do impact the access to vaccines, the ability for all communities to get to a health provider, to have access, to have the ability to pay for it, the ability to transport, the actual providers in their area, the ability to get off work. I mean, there's all sorts of things that impact access to vaccines. As I mentioned earlier, it is a focus of Iowa Immunizes to ensure that we look at everything through a health equity lens. It's very important in the world of immunizations. We're seeing this with COVID. We know COVID has disproportionately impacted our communities of color. We see this in Iowa. And we also know that the inequitable distribution of COVID-19 vaccine is something that we are challenged. We know that there is racism in public health. We are acknowledging that. We are acknowledging that as an organization within IPHA. Many of your organizations are acknowledging that as well. It's important that we state that and acknowledge it, and that we realize that there has been and continues to be medical trauma that affects our communities. And it's important that we keep that in mind, and we're having that, ensuring that we remember that in our work within the coalition too. There is a lot of good work going on within immunizations in the communities of color in Iowa, and we want to amplify that as a coalition and make sure that that work continues as we can, as far as amplifying that work. We have many Black leaders in Iowa sharing stories of getting the COVID vaccine, for instance. And there's a lot of good work being done across the country as far as that is concerned. I think there's a lot of information in the chat right now regarding kind of access to COVID vaccine. There are no answers on this. I wish we did have answers. We need more vaccine. We recognize the important work that our local partners are doing to distribute that and to distribute that equitably. It's hard. It's hard work, and that is why we're lucky in Iowa to have each other to work together on that.
We have to recognize the difficulties here are so multi-layered, because we have obviously the access to the vaccine itself, which is reduced on account of just not having enough vaccine. And we have distribution, getting vaccine to counties, and how we get it to not just counties, but each place. And then we've seen this discussion about what happens if you don't meet your benchmark, and then do you get penalized? And how does that disproportionately affect communities in those counties? And then we have disparities in how to sign up for the vaccine. So you can't, it is so difficult, even as somebody who, I mean, my kids don't think I'm super computer savvy, but I think I'm relatively computer savvy. And it's work for me to get people who qualify right now for their vaccines. Like even to just the level of monitoring, the level of computer sophistication that you have to monitor multiple sites and get on some lists is a deterrent to, again, all kinds of different demographics. And so those are all struggles that we do our best to advocate for equity in, and but it's not a problem that's easily solved by this coalition.
Yeah, and we recognize it's those of you at the local level that are living through that nightmare, and we empathize with you, and we're, hoping for more vaccine forever. I did a good chat from our friend Chris Essel as a local public health administrator, and the importance of education of different communities within their county, different populations that may not have a good immunization rate or may have high exemption rates. So we recognize that work that's going on. And as a coalition, those are some goals of what sort of work can we do to assist those on the ground individuals and the school nurses and all of those at our local level that are really educating and sharing about the importance of all immunizations.
Thank you. I suppose on a more broad note, based on all of this need for like the daily just struggle of, especially right now, with COVID vaccine rollout in play, with the major shortages and everything that we're seeing, but even on a regular basis, just why is there need for a coalition for immunization, and how can people get involved with that beyond, of course, you've talked about the standing committees and things like that, but how can people get involved in immunization in the coalition more generally?
Yeah, so are you okay if I take that, Nathan? We've addressed it throughout the conversation already, but there is definitely a need for a coalition. We have many different partners in Iowa that are working towards similar goals, but we are all of you are stretched very resource thin, although, very heavy with passion. And so by working together and having a collective voice, we can make more of a difference. We cannot always depend on just Lena at the Capitol testifying on behalf of immunization. We need multiple voices. We need to show the school nurse be the only one advocating for staying on schedule. We need to all be working together to make each other's job easier. So that a coalition is just a way to organize that and to ensure that the work gets done in the most efficient manner. And I think that we've seen that. We know that as part of public health. We know that working together is how we accomplish things more. Obviously, we need to be working together, like we said, to have a collective voice when it comes to educating our policymakers, and also for combating misinformation that like such as social media misinformation, and providing access to good information and assisting each other with sharing in what are good resources. So we have, and as part of being a coalition, we're able to network with other coalitions in other states, with nationwide coalitions and organizations, and have the opportunity to get best practice from other areas and bring it into Iowa and get assistance to make sure that our immunization rates do stay high. Anything else, Nathan, on why we need a coalition besides the fact that it's super, all be together, right? Oh, you're muted, Nathan.
Yeah. So no, I completely agree. And I think the answer kind of speaks for itself. Obviously, groups working together, teaming up together, this is how we make changes. We don't do this thing in a vacuum. But what I think is the biggest thing with the coalition for this in particular is how it is, this is like the third or fourth time I've said this, but how vaccines impact everybody, which is true about a lot of things, and certainly true about a lot of things with public health. But recognizing and gathering together people who you might not necessarily associate with even public health or with vaccines in particular, and bringing them all together. And everybody's saying, we've got dental groups saying, hey, you know what, this impacts us because HPV impacts, that impacts us directly, it impacts our patients. We're on board with this. Seeing other groups recognizing, health equity groups and that kind of thing, recognizing how these things impact their populations. it's kind of an amazing thing, and it's very necessary when it comes to something like this, that again, immunizing isn't necessarily that flashy of a thing, because everybody pretty much does it, but it needs advocacy so badly.
For sure. And that advocacy, not just legislative advocacy, but advocacy and our friends and our new moms in our life and those individuals. I put in the chat our website that you can go check out, as well as it's pretty simple to get involved in Iowa Immunizes. There are the ability to, you just click on that little doc form and fill that out and you're added to our listserv. You can get as involved as you wish. We have many members on this call right now that are part of various committees. We have some coalition members that just tune into our not just, but are able to tune in to our monthly coalition meetings. And we have some that are just able to take our information and share it as appropriate with their partners. And we welcome any and all involvement as we can show and share that we are all working together. We are only adding to our strength by doing that. So it's pretty simple to get involved. There's no big hoops to jump in. We just want a valid email and make sure you're on the correct side of immunizations. So that's all we ask. There's no cost to be part of the coalition. And as we said, it is supported by IPHA. So your membership in IPHA is what supports our coalition work.
I'll do a shout out to our social media as well. So
Yes.
Please follow us on Facebook. So you just look for Iowa Immunizes on Facebook. You can find us on Twitter. We would love to get some more Facebook and Twitter followers, especially Facebook is approaching our 1,000 followers. So you could be that one. There's no gift yet, but maybe there could be. So get on there. And yeah, interact with us and please share our stuff. We would really appreciate it if you would share that our social media accounts exist to your friends and get followers for us and help us to develop this coalition.
We have a Iowa Immunizes lapel pins, Nathan.
Oh, that's true.
With our partners in immunization. So we might be able to, raffle that out to our 1,000th member. We will be up to like 1,500 by the time we get our t-shirts out. We're just getting started with that. So, but it is important that we have those individual voices as well. Stories about your experiences with that vaccine preventable diseases, reasons why loved ones in your life need that herd immunity. Those stories matter to share, for us to share on social media, for us to share with our policymakers. And so we welcome that involvement.
And we're doing regular postings of selfies for people who get their COVID vaccine. So if you are if you have a photo of yourself, it doesn't have to be an actual selfie, but if you have a photo getting a shot or afterwards, or you have your Band-Aid or whatever, if you're willing to send that to us, you can send it through the social media channels, or I think Elizabeth has an email or something she can tell you. We can share as much or as little information about you on there as you want. If you just want your first name or something like that, that's fine. Or if you want to put your name on there, great. We would love to share you.
Yeah, and any immunization. So if you just are getting your flu shot, shingles, or any of your childhood immunizations, we like to showcase all that. Just recently, we've been really focused on COVID vaccines, of course. We have a question there if we're on TikTok. Rachel, that's a question.
Not on, yeah.
We're wondering whether or not we put some of our limited towards that. We're gonna have to get some volunteers that are a little bit younger than Nathan and I for that.
I was gonna say, no, we're not on TikTok, but if you have TikTok skills, we want you
yes,
to be in charge of our TikTok account. So please reach out to us and you can be our TikToker.
Well, thank you both for all of that information on how you can get involved. Maybe a TikTok will be in the near future if any of that skill set is in here. I agree with you, Nathan. You said the answer to the question, why is there need for coalition, that kind of explains itself. I like that answer. And thank you for the information for all the ways that people can get involved. to help build that coalition. So now, are there any questions from the audience to put in chat? Open it up for general discussion. Any remaining burning questions from people?
Nathan, this is Rachel, and I actually had a question for you. Like, of all the things that you could be interested in as a pediatrician, why did you choose immunizations?
So this story kind of goes back to when I was a medical student. I had a situation where I was doing an away rotation family practice, and it was out in the Quad Cities area, and there is a decent amount of vaccine hesitancy there on, as far as I can tell. I think it's on account of the chiropractic college there. And I actually had patients that were students, the family were students there. And that was my first real interaction in which I was kind of talking to them about vaccines, and it seemed pretty run of the mill to me. And they were getting agitated and telling me about, needing to recognize these things about vaccines that they believed. And so I was kind of carpooling with people. And so on the way back, I was kind of talking with them and was like, where do people get this information? What is going on? And that started some of that. And I saw cases of preventable disease. I saw deaths that would have been preventable had the child been immunized in the PICU during my residency. I saw a lot of things like that. And there's also kind of I would honestly say there's almost like a puzzle. Debunking misinformation is really interesting to me. There's almost like a puzzle element to that, to be like, okay, there's an answer here. We have evidence we can look at. So I'm going to kind of solve this. I'm going to show how this misinformation is wrong. And that's really interesting. It just kind of scratches like some kind of puzzle itch in there too. So those all things together is how I kind of got interested in this, and have been doing it kind of since I've been in attending.
Thanks for the question. And that's a very interesting interesting idea. I wouldn't have thought of that as a reason for vaccine hesitancy. From in your background and the reason with the chiropractic college, I wouldn't never have thought of that. Do we have any other questions from people in the chat?
I did get a direct message, Rachel, of someone saying they're willing to help us with TikTok. So we can add that to our communications committee work plan.
Awesome.
So start coming up with Nathan's real good at vaccine parodies. So I think that songs are kind of part of TikTok. I don't know. I can't even handle Twitter, so I won't be helping with a TikTok account.
I think that would be a great help to jump on the music trends in TikTok.
I'm excited. I've already gotten one of you signing up for the coalition. So woohoo for an easy get involved form. I'm looking forward to working with many of you in the future, at least serving as a resource for you within the coalition.
That's good. All right, were there any other questions here that we missed? I don't think so. Did either of you have any other direct questions?
I don't think so.
All right.
I don't see any.
Well, in that case, thank you all for coming. It's been great. Thank you, Elizabeth. Thank you, Nathan, both of you for sharing your expertise. Thank you to everyone who's here for spending your lunchtime with us. Do you have any other closing thoughts before we go? We just have a couple minutes left anyway, so.
I just want to thank you all for being here. Thanks for hosting us. And I think really the things that I want to leave you with are be willing to share your immunization, your good immunization information, your positive experiences when you get your flu shot, whatnot, your COVID shot. And also find us and connect with us. We would love to have you and connect with you.
Yep, Nathan ended it well. Thank you so much for joining us, and we look forward to being with you more in the future.
Absolutely. Thank you both. And make sure to follow them on Facebook, Iowa Immunizes. Get them to 1,000. Maybe you'll get the lapel pin. Thank you both for all of that information. We hope everyone will join us again next month on our third Thursday, which I think is the 18th. And we'll have Audrey from the University of Northern Iowa's Environmental Health Program talking about farming for public health. The IPHA Education Committee is still planning topics for the next season, starting in, I want to say, September or so. And I just remembered I was supposed to share my screen and bring that schedule up, but those will start, I think it's September. But we're still planning topics for that. So if you have any ideas, if you want to share your work or the work of any other public health professionals that you know, we encourage you to share that with us. And if you have an interest in joining the Education Committee, we encourage you to do so. As a reminder, IPHA is a nonprofit organization. We rely on our membership dues and sustaining donors to support our mission. If you're not already a member, please consider joining IPA, and students, if there's any on the call, you can check with your department chair because some programs have funds to support your membership. If you are a member, thank you very much, and we appreciate any donation that fits within your budget. You can join and give at iowapha.org. Recordings of this Lunch and Learn and all others are archived on Iowa Public Health Association's YouTube channel, where you'll also find any other webinars that you may have missed or like to revisit. Thank you all again for being here. We hope to see you next month. Have a great day.